can. Hi, good afternoon, everybody. Welcome to this session during your lunch break and during the escape room. So this site, my name is Vicky Lefevre. I'm the head of unit public health functions in ECDC, and I will be moderating this session together with Philippe Abdelmalik.
Afternoon, I'm Philip Abdelmalik. I'm the head of the unit at the WHO Hub for Pandemic and Epidemic Intelligence based in Berlin, specifically for the unit of Intelligence, Innovation, and Integration. Back to you.
So this session will be all about technological advantage for public health intelligence, epidemic intelligence. So the session will be split in 3 parts. So the first part will be Luigi Spagnolo from JRC, who will tell you all about the EIOS, the Epidemic Intelligence from Open Sources, and the new technologies that have been used in this initiative. And then he will be online. And then in the second part, we will have Gianfranco and Mercy from ECDC and Africa CDC, who will explain you about how we each in our institutes go about epidemic intelligence and event-based surveillance, the tools that we use, the innovative methodologies, the strengths and the weaknesses, and also the way forward and the needs for the future. And hopefully, if everybody sticks to their time limit, we can have a nice discussion in the end, also involving you, looking at the way forward. So if you have any questions, you know the drill. Please post them in the chat, and we will take them on. I hope in the meantime, Luigi is online and ready for the first presentation. So Luigi Spagnolo is an IT solution architect currently working at the Joint Research Center, which is part of the European Commission. They are based in Ispra, Italy. He's part of the disaster risk management team, and he's actually the person coordinating the design and the development activities around the web portal of the EIOS. So he will explain you all about the system. Luigi, please, if you are there, the floor is yours.
Hello. So I'm working for the Joint Research Center, and basically it's the Science for Policy Service of the European Union Commission, and there are 2 units that work to the EIOS system, the text and data mining, and the one I'm part of is the disaster risk management unit. Our support to the broader spectrum of public health intelligence actually starts 20 years ago, where when Europe Media Monitoring has been created, first to support basically press release, but soon also it was used to cover infectious diseases, and that was medicines. Then on top of this technology, 2 portals were born, one for the Global Health Security Initiative of the G7 plus Mexico plus the European Union, and one for the World Health Organization. Building on the experience of these 2 portals, eventually we came bringing this together to, let's say, EIOS system that tries to harmonize the 2 systems into one unified approach. And current development are under the administrative arrangement between JRC and the GERA, which is a new body within the European Commission to tackle health emergencies. So the key systems of the key features of the system are information monitoring, collaboration and knowledge management, and finally, contextual information once a specific signal of a potential public health threat has been identified. So, one important aspect is that concerning the collaboration is that EIOS system is centered around communities. So different organizations and networks, such as the one you see in the slide, that basically have their own mandate and interest. Could be some like WHO are more on human health, some more animal health, and so on. And they can work in a separate space, but also collaborate together in the same environment. How the system works, so there is a processing chain that harvests articles, classifies them according to a number of topics, and then finally all this in metadata comes into the EIOS portal for further monitoring and analysis by expert analysts from these organizations. So this is a bit just to give you a sense of the different modules that are involved in extracting metadata, such as entities or other topics, translating and so on. The main topics are these categories of interest that are covering all hazard and according to all hazard and One Health approach every possible aspect related to public health. So they are built as keywords and patterns of words into multiple languages, and they cover several aspects such as not just diseases, but also symptoms, disasters, capacity of health systems, and so on. And then all this information is brought around a concept called board that is let's say a specific focus for situational awareness and that so you can filter this media and other articles according to a combination of filters that including the categories of interest, but just also countries and so on. Then this goes into a stream of articles and some visualizations, and then can be finally, as you see, be curated by users and commented and so on. And finally, this can be more, this is increasingly going into external systems. So the iOS system is not isolated, but needs to interoperate with other systems that are carrying on other analysis. For instance, just to give you an example of, this is West Nile in Europe, West Nile fever. And as you see, we can see here the distribution over, let's say, space of mentioned locations with this heat map, but also the distribution over time. And you see, of course, there is a kind of seasonality of this phenomenon, and maybe you can see a trend emerging by exploring the data. Also, as I said, there is the contextual information. So to help understand whether a specific signal is of particular concern based on the context. And the integration, the initial integration is a set of composite indicators that cover the main risk components such as the hazard exposure, vulnerability, and coping capacity of the specific country. And in the future, what we want to include is a broader knowledge graph or linked data on disease profiles, what symptoms they have, and also what medicine can treat that, let's say, disease, and also past events to see whether there is a similarity. And this entails the creation of an overall ontology for public health intelligence, but also in a broader sense for all disaster risk management. For instance, this is just an example of connected always with West Nile virus. Let's say the exposure to specific mosquitoes as an indicator of risk. And then you can see other possible, let's say, vulnerability, for instance, indicators of risk factors that, for instance, case for Spain. What is finally our envisaged work, let's say? First of all, one issue is that we are dealing with a large number of articles per day, so analysts needs to really scan through, even if they are pre-filtered, but still are thousands and thousands of articles per day. So one thing is to group these articles into stories that talk about the same events that are unfolding, and also to improve then name the entity recognition, so to identify, for instance, certain people, but also certain, for instance, companies that are suppliers of antibiotics, for instance. And then to improve geolocation is another goal, to reduce this noise of information. And then also what we are working on is creating smarter classifiers and recommender systems that learn from previous user interaction. So rather than the classical machine learning relies on data sets with annotated information, we want to use the expertise, the previous curated information produced by expert users in the portal to, let's say, reinforce this learning of the classifiers. So that would also lead to the potential automatic identification of events of interest, such as the first case of a disease in a country, a new host that is affected by a certain disease or certain virus, for instance, or a case surge, some kind of this kind of specific signals that trigger the interest of the public health experts. Also, finally, but last but not least, we want to improve the collaboration and reporting. So to have, on one side, better communication, collaborative monitoring across teams that may belong to different communities, so to share part of the work, but still retaining control on what can be shared or not in terms of sensitivity of data. And finally, we are also ongoing experiments on, as many are doing, on language modules to support this summarization and curation of information. So imagine you identify an article about a certain disease and cases reported to extract the most relevant data from it, including numbers and figures that then you can use later for your analysis. That's it, pretty much. Here you can see some information, more information, the initiative itself from WHO, but also you can see here, if you have a QR code, you can see any poster on the system. And finally, this is the portfolio which aggregates all the activities, including the one on the EIOS system, into the broader scope of situational awareness and crisis management. So it's the way JRC is aggregating and enhancing, let's say, also the synergy between different projects. Okay, it's over for me.
Thank you very much, Luigi. I think it's a very good start of this session, setting the scene about the history of the EIOS and how it functions, because this smoothly goes to the next topics, which is the practical implementation and the daily use. So I will hold off with the questions for now, and I propose we go to the next speaker. So I give the floor to you.
Thank you, Vicky. And maybe, are you going to speak from the podium?
Yes.
Yeah.
Yes.
So as Gianfranco is making his way up there, I will introduce him. So Dr. Gianfranco Spiteri is, well, he joined ECDC in 2010. That's over a decade ago, not to make you feel old, but experienced. And he's currently the group lead of the Epidemic Intelligence Unit in the Public Health Functions, an Epidemic Intelligence Group in the Public Health Functions Unit at ECDC. He's worked on various surveillance activities for several infectious diseases, is trained as a medical doctor in Malta, and he is an alumnus of the EPIET program. So over to you, Gianfranco.
Thank you, Philip. Thanks for the nice introduction. So I'll talk a bit about how we do epidemic intelligence at ECDC and how we implement new technologies, including EIOS in our day-to-day activities. So I'll do this by guiding you through a kind of the day of an epidemic intelligence officer at ECDC. So we have two colleagues here, virtual colleagues, but some of you might recognize the names, Andres and Katarina, who work within epidemic intelligence. And they're part of the 24/7 duty roster. So we have a roster, so every week we have two persons working on kind of detecting threats in the team. They might come from my group, but also across the organization. So this is a very nice collaboration across ECDC. And their role is basically to implement part of ECDC's founding regulation, which talks about threat detection and assessment, and communicating about the threats that we detect, both to experts, but also to the public, as you can see there. So Andres and Katerina have a very busy day. They drink a lot of coffee, as you can see. And their day focuses a lot around screening open media sources. So they start at 8:30 in the morning, so a bit earlier than most people at ECDC, I would say, and work through all the open media tools that we monitor. And then they have another round at 2 o'clock in the afternoon, more or less, and one of them would be on 24/7 duties or working even in the evenings and doing another round of screening in the evening. And until last year, we had kind of this system which we used looking at many different websites, tools, and applications. So kind of pre-EIOS, we were using ProMed, different websites, HealthMap, Medisys, GIFIN, Twitter, X, whatever you can think of. So it was a bit of a kind of chaotic, in a way, environment for us, which made kind of collaboration a bit more difficult. So particularly Andres was very stressed with this approach. He had to screen more than 3,000 pieces of information every day, communicating about them, summarizing, and yeah, not good for your mental health, I think. So then earlier this year, we've had quite a lot of training kind of through the work of the Pandemic Hub and with our colleagues in WHO Euro on EIOS. And you've heard quite a lot of detail from Luigi about the system. But kind of from an operational point of view, it brings a lot of benefits to us. It brings together all the sources that we had before. So kind of before we had all these different systems, but now we have them all brought into one platform which we can use. So it really facilitates our screening activities. We can have teams working on screenings, kind of one board, for example, starting then kind of concurrently, maybe someone else screening the same board and seeing what the other person has screened, so there's less duplication. We can organize ourselves with boards, as Luigi was describing, in a very efficient way, so we can see what the priorities are for ECDC in terms of monitoring, can define very kind of specific boards for this. We can monitor specific events as well, so we can describe what categories would fit for a particular event based on country or some specific categories, diseases, syndromes, etc. And this makes it a very nice way of working in a kind of more systematic way, making sure that we don't really miss anything which is relevant. It also allows good interaction both within the team and also across teams. So we work within the team, different people work on different boards, for example, concurrently, but also other groups from ECDC can monitor other boards built for them. For example, during COVID, we working with the healthcare infections group, healthcare-associated infections group, monitoring long-term care facilities together. So this is really all quite nice. And also with Mercy and the colleagues at Africa CDC, we have set up joint communities, which allow us to work nicely together. So that's one part of the work that we do. Then, besides the monitoring of open media sources, we also review data reported to ECDC. So as you know, member states report information to ECDC. There's different ways of doing this. There's indicator-based data and also event-based data. And focusing on the event-based side, we have this tool called EpiPulse, which we have developed in the last couple of years. It's not open source, but it allows member states to report data on or information on outbreaks they're monitoring and public health events in a very kind of standardized way across many domains and different diseases. So this brings benefits to ECDC in terms of monitoring, but also to member states in the sense that they know what to expect and report in a similar way for different types of events. So we also use the system to document events or items which we detect via our screening in EIOS. And the EpiPulse also allows us to summarize, to use the comments from countries and summarize relevant events, and then bring this as kind of for better situation awareness for colleagues in member states. The tool is also used for presenting at the roundtable, which I'll talk a bit about it later, which is where we take the public health decisions at ECDC, and also the production of our output. So this is all integrated in one system. So the next part of the day for Katarina and Andres is preparing for the roundtable, presenting at the roundtable, and then producing the outputs linked to the roundtable. As I said, the roundtable is like a key meeting at 11:30 every day at ECDC. We discuss there all the items which might need action from ECDC side, which could be developing surveillance systems, validation of information, or providing recommendation to member states. This is all now automated via EpiPulse, and we've also used the opportunity of having EpiPulse and the EIOS as the two main tools to automate some very mundane functions, which you might think maybe are not very kind of time-consuming, but in a very stressful environment, it all helps to make everything work smoothly and more systematically. So we've automated, for example, alerts for the roundtable and agendas for the roundtable. So every day at 11:20, you get an automatic list of items which we're going to discuss. We've also created a bot which we use to interact with to distribute our reports, our daily and weekly communicable disease threat reports, again facilitating a lot the work and the standardizing and reducing the risk of errors as well. And we're also using EIOS, and with the help of Luigi and colleagues, automating the extraction of items which are detected in EIOS for further use or sharing with other colleagues. All this has allowed us to produce very rapidly outputs in response to events. So our daily reports, for example, every day after the round table, we finish at 12 o'clock. By 1 o'clock, we have cleared and produced a report and shared with member states on the events which we're monitoring. So we wouldn't be able to do this without tools like EpiPulse. We've managed to produce dashboards as well. EpiRadar will be public soon, and also first as a restricted tool in EpiPulse, but then on a public site where you can easily see events which we're monitoring and other outputs which we've also automated since the pandemic based on experience from the pandemic. So last couple of slides just to talk a bit about the future and where we see things going. So one challenge we've had in the last year, I would say especially, is about improving coverage of social media. You've heard about what has happened in X with X probably. This has become it's become more challenging to monitor efficiently social media. So it's something we would like to work on. We also want to better integrate indicator-based surveillance data with our event-based data. So countries report data on kind of in a less structured way in EpiPulse, but we also have the indicator-based data, which is more structured and more detailed. So we want to have ways of analyzing this data and bring trends and insights from the data to EpiPulse, to our situation awareness. We're also thinking about large language models. We're thinking about automated summarization. So if there's a new event, many countries might send comments very, very rapidly. And this could allow us to very quickly have a draft summary for our experts to check and to inform the colleagues in the member states back on what is happening overall. One other challenge we face is with personal data. Sometimes some personal data slips into EpiPulse, and we can use models to detect this and maybe alert member states before it goes public. Another area which is important for us is providing context, so both using EpiPulse information itself, so maybe previous events which have already been reported on the same disease, same country, and this could, through large language models, we could add information and contextualize a bit more the events. And finally, we need better collaboration with member states. So this is something which we can work on as well. One point which also Luigi mentioned is annotation of data sets. We want to be able to annotate the information in EpiPulse and the EIOS as well. So this could lead to better kind of threat detection in the future and automation. One other area which is kind of essential for us is focusing on integration of systems. Again, Luigi mentioned this. We want to link EIOS to EpiPulse to be able to automate the process of threat detection a bit more, and also then to provide linking EpiPulse to EWRS, which we're already working with. EWRS is the risk management tool in the European Union, so we can provide better situation awareness to risk management, to risk managers in their outputs. And just finally, just to say that with these tools that we have now, which we are tailor-made really for epidemic intelligence, it really facilitates our day-to-day work. We see increasing efficiencies through the tools that we're using, and we can further automate many of the processes that we have, and we have many ideas about kind of beyond what we described about how we can do this. And artificial intelligence, of course, brings additional possibilities. Having said that, I think we need to do this in a very responsible way, thinking about the quality of the outputs. We shouldn't be automating for automation's sake. We should be providing better kind of outputs and service to the member states and the colleagues working on the systems. We need to improve, maybe this is something which we need all to work on improve the collaboration with different stakeholders, both within EpiPulse, but also maybe through EIOS, which is something which is ongoing, to reduce duplication of effort, for example, which is happening at a global level, I would say. And also considering the IT landscape, which is changing very rapidly nowadays, as you know, we need to think about the ethical use of these technologies and also some issues which may come up regularly around copyright, use of data, and data protection issues. So I think that's it from me, and there you can see who the Andres and Katarinas of the team are who have contribute to all this work on a day-to-day basis. Thank you.
Thank you, Gianfranco, for that. We're going to hold questions until the end, so it's my pleasure now to introduce Mercy, Kiang Mercy Tetu, who's an epidemiologist, also experienced with over 10 years in strengthening health systems to detect and respond promptly to public health threats. I'd encourage everybody to look at the bios on the website because there's a lot more detail there than what I'm giving, just so we can move quickly with the time that we've got. But I will say that Mercy leads a unit that focuses on early warning through mostly event-based surveillance and how to strengthen that across the region, but also working nationally and continentally. And before that, before joining Africa CDC, which is where she's at, Mercy served as the executive director of Value Health Africa, where she developed and coordinated projects on early detection and reporting of national priority diseases. Thank you for joining us, Mercy. Over to you.
Thank you so much, Philip. Good afternoon, everyone. I'm sure you should be wondering, what is Africa CDC doing here? Definitely, we know diseases know no boundaries. So if we don't have strengthened systems on the continent, that we're going to spill over to Europe and vice versa. So that's why I'm here. So I'm going to take us quickly through this Africa CDC event-based surveillance processes and how we do manage our events. And we're going to be looking at a few quick areas: what we do when it comes to event-based surveillance at Africa CDC, what processes we take to improving early detection, and also looking finally at how we manage our events that have been detected through those processes. So basically, why do we do event-based surveillance or epidemic intelligence on the continent? As Africa CDC, we have, as part of our mission, to improve detection and response for the continent. And we have as one of our very core values early detection and dissemination of data or information. And basically, in our internal system, or the way we conduct event-based surveillance, we have these very key steps that we do follow, and which involves detection of the signal, data capture of the signal, and also the verification, risk assessment, and alert and response. And these are the different steps that, as Africa CDC, we thought it was really important to digitalize, just so that we can be able to improve on our processes. We have developed an event-based surveillance framework that guides this internal process, as well as strengthening the capacities of our member states to be able to do the same. So basically, we detect from all these different sources that you see. We look at it from a whole hazard perspective, and we have several sources that we do look into when we detect. Just the way Gianfranco explained, for ECDC, we follow a similar approach, but we have 5 regions, and each of these regions are manned with 2 EBS analysts who do our daily screenings. And we screen not only from EIOS, but also looking at other offline tools, like member states do send reports directly to us, and sometimes we do detect from these reports offline, as well as detecting from other known known public health line ministries, like environmental ministries. We also look at ministries of agriculture and other different ministries that are relevant to the different signals that we detect. But just to highlight that EIOS has really facilitated our work, and it's really our main web source that we look into. So we have, like I explained this, we have several regions, and we have the analysts who detect and report to the member state. The member states now help us to verify the information and then send back. And we also have other partners that we work with to verify other cross-continental events that may not necessarily happening on the continent, just so that we can all be able to improve global health security. So when we detect this, we definitely have to process this information, and we have to manage this information. So we had to look critically into the tool that should help us process this information, the digital tool, by the way. So we were actually keen at having an open source platform, looking at a tool that can also support the workflow that I just mentioned, detection, verification, to where we get to risk assessment, and then generate an alert. We were also looking at the tool that can help us store this data and helps us to also visualize as well. A tool that can help us to manage our timeline metrics. And we're actually falling on the 717 that has been championed recently by Resolve to Save Life and WHO. And also a tool that could help us build on collaboration, looking at it from a One Health perspective. So we had consultations with different institutions that had some sort of an event management system in place, but of course we finally ended up with the DHIS tool. And even though the DHIS tool could not help us do everything, we had to import other applications that can support some of the functions that we couldn't have in DHIS tool. Some of the very interesting things that we've been able to do include integrating the EIOS into our system. Let me not say integrating, but linking both systems in a way that we have a signal importer application within our event management system that pulls signals directly from the EIOS into our system for further processing. We also have a tracker application that facilitates our work. So all the signals that we detect, daily we analyze these signals and we are able to keep track on what has been done and what needs to be done so that the different analysts in the regions can take it up and get them done. We also have an automated risk assessment tool that has been embedded in this event management system that has really facilitated and reduced subjectivity in the way we assess risk. It's kind of rapid risk assessment though, but it's really helping us to come up with an initial risk that can initiate action from our response division. So you can see the risk algorithm offline, but of course this has been digitalized in a way that we just have the analyst answer a few questions about the event that has been detected and arrive at the risk level. And again, as you can see, the risk assessment follows a multi-sectorial approach, therefore means we're not really assessing only risk for human events, but we also are able to assess risk for animal events and environmental events as well. And it's also helped us to automate our reports. How many of us do receive this report or are stumbled on these reports by chance? Fantastic. So I'll give this feedback to my team that we have a number of folks here that are really looking up on the report. So these reports have been generated by our team every week, and they're published on our websites now. And it's from the system, and thanks to the great work that our regional analysts are also doing. So we also have some dashboards, and the information that has been pulled, of course, from the EIOS, we call it raw data, and when it's processed, it gets into our event management system. But this information at a level where it gets into our event management system is being pulled into other tools that we have, especially during COVID, where we had the hotspot dashboard that had certain It had certain indicators that we're monitoring. For example, test positivity, mortality, incidence rate. These are all indicators that we were actually monitoring from our event management system, and it helped us to propose measures, control measures to member states. And also on the right, you see outbreak brief. So it's a disease-specific brief that we also generate. The previous I showed you is like a summary brief of all the events, but this is a disease-specific brief. We have the same for monkeypox. We had the same for dengue, yellow fever, and other diseases. This system currently, we are not just at Africa CDC using this system, but a number of member states have demonstrated interest, and we've helped them to customize to their local needs. So we have Lesotho, Sierra Leone, Tanzania, Uganda, Zambia, Rwanda currently implementing, and Eswatini that are currently implementing the systems. And we've also been able to train their local teams to be able to do further customization and also help them to manage their timeline metrics as well using the system. Where we hope to go, we want to really anchor this into the bigger continental flagship initiative, which is the Africa Digital Transformation Strategy, where we actually transforming the public health landscape for member states. And also, we want to automate alerts and notifications from the system directly to our response team. There's something that currently exists within the system, but we really want to augment it and also ensure that this spans beyond just Africa CDC. Member states that are sharing the data are also able to receive these automated alerts. And again, just like everyone is moving towards machine learning, AI, and all that, of course, we want to also improve looking at historic data just so that we can be able to use that for forecasting and predictive analytics. And we are currently creating a live dashboard that all of you can go in there, maybe hopefully by February should be up and running, where you can actually go on and see what is happening where, and you're able to see the different public health threats on the continent, and that can also help in resource allocation and also minimize duplication in response. We also want to build disease-specific instances on the system that's currently being worked on, and in such a way that we have member states just like the EpiPulse and the tool that ECDC is using, whereby member states can go in there and log in. We are trying to do a similar thing. We have a workshop coming up this December, whereby we are focusing on key priority diseases, including polio, cholera, yellow fever on the continent, and member states can go in there and populate their data. They can also see, get some incentive for reporting by improving on the visualization and also supporting them in data analytics as well. So we'll be granting all member states access to the organization unit. That means that Rwanda will not be able to see Kenya's data until Kenya grants them, the rights. So we also want to support more member states to implement the event management system, and again, most importantly, pulling our community of practice that has been developed offline into the EIOS so that they can be able to share information, not only offline or using our WhatsApp groups that currently exist, but we can have the EIOS and you can share information through that, verify information in real time, and as well as communicating this information and learning best practices as well. So basically, this is my team. It's quite, now we're currently getting to 70. And these are, teams not only at Africa CDC, but in member states supporting the work our member states are doing. Thank you so much, and over to you.
Thank you very much. Thank you very much to all three of you for very hands-on, to-the-point presentations, showing the daily work in event-based surveillance and EI. Maybe we could start with one question on the EIOS and then a follow-up question also on the EIOS. I see you have been already replying in the chat, Luigi, but several people want to know if everybody has access to EIOS and who has access. So perhaps you can clarify this.
Yeah, well, it's while it is open data, open source data, the information is restricted to the specific organization that are part of this initiative. Maybe Philip can say more on this.
Thanks, Luigi. I'll keep it short. It's not open to everybody because it's intended to be part of the workflow, and I think you've seen that a little bit through Gianfranco and Mercy's presentations. Having said that, it is open to national public health agencies and institutes, as well as regional networks and international organizations that are working in this space of public health intelligence and therefore have a use for this tool within their workflow. But also just to say that EIOS is not just the system, it is also this community of practice that's been built around, or actually is at the heart of the system, and the system's an enabler for that community. So I'll end it there.
Thank you very much. One follow-up question on the EIOS. Like it brings together many stakeholders doing the same type of work on the same tool, and you've been talking in your presentation on a more collaborative approach, Luigi, and we also saw that between ECDC and Africa CDC, there's a collaborative space there. How do you see that this could even be more enhanced, like to have this collaborative approach and avoid duplication, because many people are doing the same thing? How do you see this?
Yeah, what we are doing right now is to work on a new version of the system where you have basically this concept of boards that are around a specific topic, such a specific outbreak or routine analysis. And then the idea is that you could invite other teams from other, let's say, organization to collaborate. So assuming that, for instance, there is a specific outbreak in Europe, then you could have member state ECDC could involve WHO Euro or some member states that are joining the platform, or, well, again, there could be from Africa CDC specific topics that could be tackled together. So with
Thank you very much.
yeah.
Is there anything you would like to add on this from the
Well,
practical side?
it's a matter, the main issue is the governance. So you need a very, very detailed, let's say, permission mechanism to, let's say, specify who can do what, who can see what, and so on. So it's quite complex and is part of this. So to break silos, but still maintaining some control on sensitive information. Say.
Thanks for Mercy and Gianfranco, maybe on the practicalities.
Yeah, maybe I'll start, Mercy. So I think, this is very important, and in Europe we're trying to, there's more and more countries joining the initiative. I think we need to focus a bit on how, we work through the tool together, but also operationally on a day-to-day basis, we should avoid probably doing the same thing at the same time with the same objectives, right? It's a waste of resources. So we're trying to build a bit of a better network kind of in Europe of epidemic intelligence analysts to kind of address this issue kind of partly through this collaboration. I think one other area which might be something for EIOS in the future to look at is also to make the most of all this work that's going in by different teams. So for example, we screen lots of items, pin them, but this information does not go to other teams in the EIOS. So like a hit list of what is burning right now for kind of multiple agencies, for example. So this could be another way of kind of making the most. So in the morning, if someone in Japan has been screening, then I know that they've picked this up, and we learn from each other on what's emerging and what's relevant as well.
Mercy, do you have something to add to that?
Yeah, just to say that data exchange goes beyond just digitalization, but the trust and also, showcasing the need for that to happen. And on the continent, we've been able to do a lot by setting up offline communities. And that's why I told you that we are now ripe for the digitalization, because it's worked offline. Countries are beginning to see that they need to share this information. We have these communities that have worked. So now digitalization comes to facilitate that interaction and exchange. And I think and I think it's the same thing with Africa CDC and ECDC, whereby we have this, we pushed for this joint community and collaboration on EIOS, because we've seen the benefits of sharing that information, and we started sharing offline. Before now, we said, digitalization now would facilitate this collaboration, and I think that's the way to go from the different institutions as well.
And I think just to add, this is part of the collaboration, right? So we work on EIOS kind of together or jointly on boards, for example. But then we also have we've built regular meetings between us to discuss kind of emerging events and topics, and then collaborate with each other on assessment of events and providing information to member states as well. I think it's like it builds the community right across different continents.
I mean, that's a really great segue into one of maybe the next question, because you've talked a lot about sort of this trust and the community and the engagement with one another, and of course that's a very human element. And one of the things that keeps popping up now around AI, generative AI, and is that going to take over, and all this automation? Do you see that threatening sort of that human element and the community as we look to increase automation, or what are your perspectives on that?
The way I see it is that kind of these automations that we're doing are kind of saving us from the mundane day-to-day tasks, which we spend a lot of time and effort on, but then there's kind of limited benefit, right? A machine can do it as well as a human being. And that gives us more time to spend on the human interaction. So then we can spend more time kind of discussing with colleagues across continents. We can spend more time assessing properly the events and collecting other information, communicating better across with our member states, for example, focusing on other things, maybe as well, training initiatives and other activities. So I think I don't see that it will take over, but just gives us more opportunities to use time in a kind of which benefits other colleagues in our teams and others as well.
So we've got quite a number of questions, Vicky, that are now popping up, and we've got 6 minutes left.
I know. Should we maybe talk a bit about the future, how you see things evolving, and where you see like the most benefits of automation, new technologies? Is it like data collection, data transfer? Is it on the assessment? How do you see things moving forward towards the future?
Maybe we can throw in one of these questions into that because it fits. One of the questions here is, how do you also see surveillance models working with large language models, LLMs, if you have a comment on that?
Okay, so looking at the future and the projection that as a continent we are all moving towards, I think it's important to acknowledge the growing space of AI and also machine learning and all those new technologies coming up. And I think as a continent we've really been battling with data that do exist, but because we are not able to, assess them or analyze them, and with the little capacity that we have. I think these new innovations are going to play a very huge role in giving us deep insights on some of the events that we're dealing with. And again, looking at climate change and cholera, for instance, most of the cholera cases that are spontaneous on the continent are happening in the context of either conflicts, droughts, or storms and all those. So we begin to see how, and we have historic data about this, but just because we are not able to, triangulate all these different data, do some certain predictions, it takes us unawares. But again, this information with these different new innovations and technologies could help us in better preparedness. And so we will be able now to provide more in-depth analytics to our leadership on where we need stockpiling, for instance, vaccine stockpiling, because we are able to predict that, hey, in the next 3 months, this is what we're going to have. So I feel like in the next months, and with the embrace, of these new technologies, the continent is going to be more prepared because of the information that we're going to be having, the analytics that we're going to be making, and this is also going to save us cost in response.
Thank you very much. Do you want to give some feedback on this?
Yeah, I think I agree with Mercy. I think it's definitely kind of this is where we will go, like with analytics, and we can just start even with basic improvements on data flows and the ways we analyze data and automating these processes, and that would already give quite a lot of benefits. Then with the large language models, as you said, as we said before, with summarization of information, like you mentioned, contextual information around events. I think this will be one way where we can really benefit. Instead of having multiple people looking up information manually, we can have tools like EIOS scraping the information, then using maybe other tools or EIOS itself to bring together the context, and then having better situation awareness, linking it with indicator-based data as well. So if a country is worried about an event, I don't know, I mean, we've been talking about mycoplasma pneumonia, right, recently, collecting information on on mycoplasma pneumonia from what is available, literature, recent reports, summarizing the information, and then a country posts a request for information on mycoplasma pneumonia, and maybe we have already a brief ready, which maybe was prepared by a machine, reviewed quickly by a colleague, and provided to the member states.
I think the reviewed part by a colleague is really important.
Yeah.
I wonder, Luigi, or solution architect, do you have any quick, because we've only got a couple minutes left, quick thoughts on this as well?
Yeah, well, I see there are two things. The interoperability across systems, that is an important challenge. There will never be a unique system of systems, but well, you will have flow of information across systems. And that needs also to make information more easily operable. And of course, LLM can help also in this in translating information from a system to another.
Shall we take another question or
Sure, let's do
one
one
more? Okay, okay. Let's see. Do you have one in mind, or shall I pick one?
There are lots, but I do have one. I mean, maybe as a follow-up to this, and it links to one of these questions in terms of the workforce. What do you think the workforce needs to look like as we move forward? What does it take to detect or identify a signal? And how's that workforce, do you think, going to be impacted by these changes that we're just talking about right now in under a minute?
Well, 50 seconds.
Okay, that go. So on the continent, we are actually, reviewing the entire landscape on how we train our field epidemiology experts. So we are currently integrating epidemic intelligence into that continental model that we'll be launching the next months. So I think that's one of the strategies that we are looking at. And also looking at academic institutions, very important to ensure that these innovations are being tailored within or integrated within the mainstream landscape. Collaboration too shouldn't be left out. There was a question in one of the sessions about who takes leadership in technology. Is it public health or is it the tech companies? I think there's needs for that, for the two sectors to actually build a more strong workforce, because one is dependent on the other. I think I would end at that.
Thank you very much. I think you're off the hook, John.
Thank you. I was just going to say one word, like integrating data science in the team. I think that's so important. It's for the future, which is a bit different from what we do now. Maybe.
Great.
Thank you very much. Then we've used up our time. I want to thank the speakers for being here and for their interesting presentations and replying to the questions. And I would like also to thank all of you for being here during your lunch break and missing out on the escape room. So thank you very much. Anything you want to add, Philippe?
No, just thanks again to the speakers and to you, and also to Vicky for co-moderating with me, and for the opportunity for us to be here with you. So thank you, everybody. Thanks.